Welcome to Roots and Wings, the podcast from the Fox Hill School where we share ideas, insights, and conversations to help your children grow strong and soar high. I'm Melanie Little, and I'm the director at the Fox Hill School. Today, I'm talking with Colleen Shea, who is a pediatric nurse practitioner in the Pediatric Emergency Department at Salem Hospital. She is also the healthcare consultant at the Fox Hill School and mom of Kennedy, a current student at the Fox Hill School. Hi, Colleen. Thanks so much for coming on the show.
Hi, how are you?
I'm doing great.
Excited to join you today.
Yes, thank you so much. I was excited to have you come talk to everyone today because when I think of back to school, I think of, everybody's been away outside, playing in the sun, roaming free. And now we're coming back. A lot of indoor activity, a lot of people all in one place. And I think that, things arise that you wouldn't necessarily have in the summer, like illness and things like that. So I thought it would be a great thing to start us off with for the beginning of the year. If you wouldn't mind giving us some insight on, what we can do to keep ourselves safe and some guidelines would be great.
Sounds great. As we head into September, the excitement of going back to school, working in the local emergency department, treating kids with acute illnesses and injuries. We have a little bit of a lull in the summer, as you mentioned, as kids are outside. Maybe it's not as easy to share germs, but as we head back to school and as we're inside, we do see a bump in some illnesses, which I know causes some angst among parents. So
Yes.
Nothing to be worried about. We can, give everybody the tools that they need to stay healthy as we head back to school.
Perfect. So I was thinking back to when my kids were small, that they're now in college, which is a whole nother situation with the germs that they've now experienced, but we won't go into that. We'll stick with the little kids for now. But they, my kids, they were at Fox Hill, obviously, and they did got colds every once in a while, some sort of illness. And then literally once they went to elementary school, I don't think they missed a day of school. So why does that happen? And how does that all play out?
If children don't attend daycare at an early age, sometimes heading into Fox Hill School might be their first experience in a group setting. And it's their body's first experience being exposed to lots of different germs. As they're, sharing stories and playtime with friends, they're also close and sneezing and coughing on each other, which is to be expected. So having the first cold, the first fever, the first round of a stomach bug or strep throat, to be expected. But it's all the body's way of building immunity and making them stronger as they get older. And I would expect, if it is your child's first experience in a group setting, to expect that there may be more frequent illnesses the first year. And
so that's normal.
It's completely normal. Completely normal.
That's good.
Can be overwhelming as a parent trying to manage that and manage work and all your other responsibilities. But it will serve them well later, building that immunity and keeping them healthy, hopefully later on as they move through their school years.
Absolutely. Yes. The thing I can say is it gets better. Along those lines, explain, I think that the thing that comes up the most, that seems the most confused, there's certain illnesses that clearly, if they have spots on their body of some sort, or they are throwing up or something obvious, clearly nobody brings their kids to school under those circumstances, and we really appreciate it. But some things are a little sneakier, like fever. I would love to talk about that because you can get it for so many reasons. It could be a bad thing. It could be an okay thing. It could be, I think that's the biggest hurdle for parents, and especially new parents. How do we tackle that? How should we think about that?
So
the fever?
fever by definition is any temperature over 100.4. I know there's some parents I'll often hear, oh, they've been running a low grade fever of 99. Not a fever, completely normal. We're okay with that. So
Okay.
100.4 or higher is considered a
Okay.
fever. And
Okay.
basically it's just a little alert telling us that the body is warming up and trying to fight off something. It's our body's way of trying to kill off that invader, whether that be a virus or bacteria. The next question I often get is it dangerous? Do I have to treat it?
Yeah.
And the answer really is different for everybody. If you're looking at your child and they're running around, they're eating and drinking, they're playful, acting like themselves, okay to not treat the fever. Totally
Okay.
fine. If
If it's just by itself.
Correct. And that could be at 101 or at 104. We really don't focus on the number. We focus on the whole child.
Oh,
If
okay.
your child is really droopy, not eating and drinking, doesn't look great, that's when we want to use a fever reducing medication like Tylenol or ibuprofen.
Okay.
Really look at the whole picture.
So if they're lethargic or just not
Just not
themselves or
themselves, correct.
not wanting to do something that they would
Correct. Or
usually do.
complaining of just a feeling of blah. Then I would say
Okay.
treat that, see how they do.
And more for their comfort level or because it makes it go away faster or what is the
For comfort.
for comfort?
For
Okay.
comfort, yes.
So the things we do don't make the fever go away sooner. Kind
No.
of just has to
It
run its course.
correct. The fever has to run its course.
Okay.
It just makes them more comfortable while their body's dealing with the fever.
Okay, that makes sense. And then the rule from EEC that's in all of our parent handbooks is that the student has to be fever free for 24 hours before they can come back to school. So, which is a little tricky and confusing. It was for me as a parent, and it's still kind of tricky for me as the director. Can you explain why that is and what exactly why that's would be in place?
Sure. I think it helps me to look at my own kids and examples of waking up in the morning, looking at my daughter, realizing, okay, she's got a fever, she doesn't look good. That could be 7 a.m. I think of that as if you have fever at 7 a.m., you're going to treat the fever, consider that a fever day for the whole day. You may go to work, come home at 7 o'clock at night before bed. You know what? She looks great. She hasn't really had fever all day, but you still really need to keep them home the following day. Don't use medication. See what happens the following day. See if they're perked up. Make sure the fever doesn't come back. The concern is if we send the child back into a group setting too soon, that they're still spreading whatever illness they potentially had, and they may really not be in the clear. The fever could return the following day. After you've sent
Okay.
them, they're not really in the clear yet.
Okay. And then they may have been contagious at
Correct.
school and it can spread around.
Correct. And you just want to
Okay.
make sure
That
that
makes
their
sense.
body is still recovering from something, even if we don't have a clear answer as to where that fever was coming from, but that they're
Yeah.
still resting and they need that extra day at home.
Okay. And when would you so this scenario sounds like you can manage it without needing a doctor's appointment or anything like that. At what point would you recommend what would your red flags be to maybe make a call?
So I often recommend, kind of a 3-day period. If it's been 3 days, you're using Tylenol and ibuprofen, the fever is really not going away, I would go ahead and make a phone call at that point. Sooner, if you have any concerns for breathing difficulty, if maybe they're not drinking, not using the bathroom as much as they normally would, or if there's a specific complaint about pain, I would call sooner. My
Oh,
ear
okay.
hurts.
Okay.
I'm in some sort of more discomfort. But the mysterious fever, nasal congestion for a few days, which is the most common thing that we see, which
Yeah.
will probably happen multiple times throughout the school year to your child, totally
Right.
fine to manage at home for a few days using Tylenol and Motrin. Make sure they're drinking, they're going to the bathroom, not having breathing difficulty, not in severe pain. By 3 days, a lot of times they clear the fever on their own.
Okay, good. That's good to know. 3 days probably seems like an eternity
It does,
as
right?
you're living
Yes.
through it, but overall, that sounds pretty reasonable. So, as part of what we do at school to, try to mitigate, the other thing is sometimes the kids come to school, they're fine, and then they get a fever. So, it's not always, you can't always, you know, eliminate it completely from being at school, or, shows up once they get home, but they've kind of been, you know, rubbing elbows with everybody all day. So, at school, we do a lot of hand washing to try to combat as much as possible. The kids will, when they come into school, the first thing they do, wash their hands. Then, basically, at every transition, before snack, they wash their hands. After snack, they wash their hands because they, were using their fingers to eat with. When they come in from outside, they wash their hands. Before lunch, they wash their hands. After lunch, they wash their hands. So, and really, anytime if we notice that, they might have picked their nose or
Yeah.
licked their finger or all the fun things they do, if we see it, we'll say, "Oh, why don't you go wash your hands and you can come back?" But can you explain why that is? That's a policy that we have, obviously for good reason. Can you explain that?
Yeah, so
Why
I
that's so
think
important?
that's extra important, and I think it's great that I know that you do that at school, before and after, outside, snack, using the bathroom.
Using the bathroom, I forgot that.
The other thing is, if kids are coughing, to make sure that they cover their cough. And I think at an early age, it's, easy to teach in the hand. And then we need to do the extra step of hand washing. So
Right.
we've really been trying to teach kids to kind of cough into their elbow and still
We call it
hand wash.
we call it the elbow pit.
Yep. And I think it's really important to try to reinforce these behaviors at home as well. So make sure,
Perfect.
we learn, kids learn from modeling adult behavior. So making sure we're all hand washing at home, washing our hands when using the bathroom.
Yeah.
Germs are spread. Most of these upper respiratory infections and viruses are spread through cough and through droplets. So it's kind of in contact. We cough, we touch a surface. So just important to make sure that we're mitigating the spread as much as possible.
Right. And I love if if the kids see parents doing the same thing that we're also doing at school, it just reinforces like, oh, maybe that's what I should be doing.
And
So
and
it's
another thing,
great
I
to,
think, kind of a little bit off topic, but also talking about boosting immunity and things we can do at home to keep the kids healthy, is really healthy sleep hygiene. So in addition to hand washing and covering our cough, making sure that kids are really going to bed at a reasonable time and getting enough sleep, that will also keep the body healthy and hopefully fend off some viruses as well.
oh, great. Yeah, I hadn't even thought about
Yeah.
that. That's a good thing to keep in mind.
Any
Um,
tools in our tool belt to fight the illness during the school year will do.
Absolutely. Well, that's great. So I think that's super helpful advice. As I mentioned, Colleen is a mom at Fox Hill as well. Her daughter Delaney is a graduate. Kennedy's there now. She is our healthcare consultant, which she voluntarily does, and we very much appreciate it. But she is available to us, and if we ever have a question, we'll shoot her a text. Her information is also in our parent handbook if you had a question. So I just want to say thank you so much. We really do lean on you a lot, and it is great to know that you have our backs and keeping us healthy. And it's just great to have you.
The feeling's mutual. Fox Hill School is a very, very special place to our family. So I'm
Oh,
definitely, I'm always available. If there's any specific questions, other parents, please feel free to reach out. I'm happy to answer any questions. I know in
Awesome.
high volume illness times in the winter, it's often difficult to even get in contact with local pediatric offices or anything. So I'm available for questions as needed.
Oh, that is amazing. And we might have to have you back on later on in the winter when we have new concerns
We'll
coming.
pray for a mild flu season.
That sounds good. All right. Well, thank you so much, Colleen. I really appreciate you being on our show. Thank you to everyone for listening to Roots and Wings from the Fox Hill School. For more resources and upcoming episodes, visit foxhill-school.com. We'll see you next time. Thank you. Bye bye.